That is a good question. And patients ask me that all the time. They'll come in with pain because, well, pain, not necessarily because they're running, but pain that's worsening when they're running. And they ask, do I need to stop running? And that's not necessarily the case, and usually not the case. Like you were saying, there is something very important to be said about recovery. And if you can run the right way with the right mechanics and gradually build your body up into tolerating more miles, then running should not be dangerous. It's something that is healthy for your cardiovascular system. It's healthy to move your joints, move your body. Motion is lotion. We say that all the time. So running is very healthy. The important things are doing it properly. So a lot of people think about running quickly and getting things like shin splints or stress fractures in the feet, but you also have tissues in the spine that need to start to build up their tolerance for that level of activity. Like we were talking about the disc spaces, those discs, they have collagen in them that can gradually become stronger as there's more and more pressure put through them. Your spine is going to be healthy when you're active and you're doing more things, but you just have to allow it to build up the strength and build up the tolerance, just like you gradually build strength in a muscle when you're progressively lifting more weights. Yeah, regenerative medicine is a field where we are utilizing the body's natural healing capacity and making it more potent. So you naturally have healing components in your body. In your bloodstream, you have platelets. When you get a cut in your skin, platelets get there first. They form that clot. They pull that tissue back together, reorganize it. They also release signals to the surrounding tissue to stimulate blood flow, increase cell turnover. They recruit local stem cells to help with repair. So those platelets are very powerful in repairing injury. We can harness that power by drawing a patient's blood, concentrating those platelets to very, very high levels that the body can't do on its own, and then use things like ultrasound and x-ray to precisely inject them in areas that need a little help healing. And there are injuries that the body can heal on its own with time, but there are lots of structures in the body that don't have very great blood supply or that can continue to have lingering pain after an injury, and they need just a little help, a little boost in that healing potential to reduce the inflammation, reduce the pain, be a little bit stronger. So sometimes we use platelets. That's usually my preferred injectate in the spine. Sometimes we use bone marrow, which has a lot of the same growth factors, also has platelets in it, but it also has mesenchymal stem cells, which can be a bit more potent if you've got more advanced arthritis or big tears in a muscle or a tendon. Yes. Sometimes we will inject around the disc for a bulge or a tear. Sometimes we will inject actually into the disc, which is called an intradiscal injection. That is something that has been done through the years. There's been a lot of research via PRP or bone marrow concentrate, which one is better. I'm typically these days leaning towards PRP because the outcomes between PRP and bone marrow concentrate, which is thought to be more potent and typically is, they're coming about the same level of efficacy for into the disc. So we're using platelets primarily intradiscally. That is something where you can imagine if there's a tear in the disc, putting the platelets directly into the center of that disc. So into the nucleus pulposus, that jelly center that allows the platelets to kind of spread out circumferentially into the disc and kind of fill in all those tears. And it's a more potent method of getting that disc to be more solid and getting that annulus fibrosis, so that circular cartilage all around the perimeter to be nice and solid. And that helps a lot with the stability of the spine and the reduction of pain from any tears in the disc. Typically, we can still treat an old injury. So I have seen runners, I'm thinking of one in particular who was in her 40s, had a car accident in her 20s, with a disc injury that was always bothering her when she ran. She had to limit her miles, especially the older that she got, because of that old disc injury. We did an intradiscal injection and it took a few months for that disc to heal. But after that, she was able to run much more comfortably than she could in decades. And that is what we typically see with these old injuries. The thing that becomes a little bit complicated is that if you've had an injury for such a long period of time, you've started to compensate, and those muscle imbalances are going to take longer to correct, and that might be a more difficult job for you. But that is worth working on. And the platelets can really stimulate repair in an injury that's been there for a very long time. And it's definitely worth doing to get you to feel better than where you have been for many years sometimes. In the neck, often I'll see popping if there is some issue in the facet joints. So these little joints back here, as I was saying, they're joints just like a knee joint that have fluid in them, they have cartilage in them. You can get wear and tear of these joints. Sometimes people will have an old injury, a whiplash injury, a car accident, where they've had damage to the soft tissue capsules around these joints, which means then that these joints are able to move more than they otherwise could. So you can get some popping sensation because you're feeling more movement of those two bones against each other, or you can have fluid in there and you hear or feel that shift of fluid in the joint space. Sometimes there can be a snapping if you've got a tight muscle and it kind of, when you move in a direction, it kind of snaps more aggressively over the tissue that's above or below it. It's not always concerning. I know some people don't like to hear it, and I can totally understand that. And when we do treat the spine, when we're reducing the inflammation, when I inject into these joints and I try to get those soft tissue capsules to heal, it can reduce that. So it can reduce the inflammation, it can increase the stability of those joints to reduce those popping symptoms that you have.